Joining us now from the Competitive Enterprise Institute, Dr. Joel Zinberg. And anyway, it's a little chilling. Do you have any clue what disease X might be? Have you heard about this 100% variant of COVID that is 100% lethal? Have you heard about that?
Well, thanks for having me, Sean. This is just something that's being shared on social media and on various posts. It's not clear yet what they're talking about. The claim is made that this is just something created to attack what are called humanized mice, and that they all died. But that, don't worry, this has nothing to do with SARS-CoV-2, which is what causes COVID, and it has nothing to do with humans.
Well, they say that, but didn't they also say it was a variant of COVID?
Well, they're saying it's a type of what's called coronavirus, which is that class of virus. And, the scary thing, whether it's the exact same thing or something different, the scary thing is they're still experimenting with
exactly
new viruses. This is this whole gain of function type of research, which appears to be responsible for this COVID pandemic. It's, all to point towards there was manipulation of the virus and that it leaked from the lab in Wuhan, and that's what caused the pandemic. And this Fauci and company have been trying to deny right from the start to cover their their posterior.
Well, we now have the evidence, and I've urged people to get Senator Rand Paul's book, Deception, because they were in a state of panic as of January of 2020. It was first discovered in December of 2019. And they were in a full-fledged panic knowing that the Eco Health Alliance had gotten NIH funds. And with that funding, some of that money went to the Wuhan lab where everybody knew gain-of-function research was taking place and coronavirus research was taking place. Now, I just played for you the Director General of the WHO, which I don't think we should ever listen to again. I think they were nothing but the propaganda spokespeople for China during the epidemic. But anyway, what is this disease X placeholder, for unknown diseases, and that COVID was the first disease X? And what about the push and the call for other countries to sign this worldwide pandemic treaty to prepare for disease X? These people lied to us and covered for China. I don't know why anybody would ever put any faith, hope, or trust in the WHO again.
Look, the only true thing they're pointing out is that we live in the real world, and in the real world, viruses, they mutate, they change. Over time, things happen. I mean, you can have a pandemic form of influenza, of the flu. I wrote about that with my colleagues at the Council on Economic Advisors back in the fall of 2019. And we warned about that possibility and suggested that we had to be prepared to face that sort of eventuality. And that's why we had the public-private partnerships that were so successful during the Trump administration in coming up with a new vaccine in record time, in 10 months rather than 10 years. So it's just a placeholder, and frankly, at this point, it's a mechanism of scaring people into, bowing down to World Health Organization authority. But it's not something new that no one knows about. Everyone has been planning. All the countries have been planning for potential pandemics. But what's interesting, if you look back at the COVID experience, is that none of these pandemic plans before COVID called for things like masks or for the kind of lockdown measures that we were all subjected to during the pandemic by people like Anthony Fauci and the public health establishment. I mean, they kept saying, follow the science, but, their version of the science was far removed from the usual scientific method of unbiased observation and experimentation to ascertain the truth. What I detailed in that National Review article was that their science was evidence-free, it was dismissive of other points of view, and it was politically and personally motivated. And they completely destroyed the public's trust, which is why you have so few people willing to take the COVID vaccines. And, the end result, as people at the FDA and other places have said, is you're going to have thousands of preventable deaths because of this manipulation of science.
It really is an amazing thing that you're pointing out here. Now you've gotten to the point where Americans, they're rejecting all the boosters, and the numbers bear that out, and your article points that out. And what I find fascinating about this is I think most people have realized, I remember Rand Paul was slammed by people for talking about natural immunity. And he got COVID very early on, was public about him getting COVID early on. And he survived it. And then he started talking about natural immunity. He is a medical doctor. Why was that so universally rejected by the people lecturing us to follow the science all the time?
It remains unclear because that is the normal course of these viral diseases, that people get immunity after they recover from an infection, and that immunity is generally better than vaccine immunity. So it's weird that they were pushing this, and the only explanation anyone can come up with is that they were so tied into these lockdown measures initially, and then into the idea that everyone needed to be vaccinated whether they had natural immunity or not, that they were willing to suppress this idea of natural immunity. And the upshot is we had all sorts of frontline workers, first responders, folks in the military, who lost their jobs because they were unwilling to be vaccinated after they could demonstrate that they had natural immunity. And in many cases, those folks haven't regained their jobs, and we have real staffing shortages in hospitals and other places. So it was completely counterproductive, and it's really of a piece with the kind of evidence-free science that the public health establishment was willing to subject us to.
I mean, it really is when you think of Fauci saying there was no science when they were calling for or mandating social distancing, or Fauci in August of 2021. This is a year after, by the way, Ron DeSantis, the governor of Florida, opened up schools in the state of Florida. This is 1 year later, and he's advocating for vaccine mandates for school children under 12. After, by that point, we knew it was clear, and your study points this out, your article points this out, that younger people had zero to no risk of any severe COVID-19 disease or mortality. And I could anecdotally tell you, any young person I know that got COVID, they were all 100% fine.
Yeah, look, in Sean, it's almost worse than that, because Fauci has published some scientific articles where he has said that we had really right from the get-go reason to believe that the vaccine for COVID would not be terribly effective at interfering with transmission of disease. It wouldn't protect you from getting COVID. And whatever protection you had would be very short-lived. So we knew this all along, and he also had access to the data showing that with each new variant of COVID, whatever protection that initial vaccine had was getting less and less. Yet he persisted in these crazy mandates. He knew that it was unnecessary for school kids, yet he was pushing them. And it wasn't just him. You had the CDC pushing for these vaccine mandates for kids. And they weren't being advised by scientists. They were being advised by the teachers' unions. I mean, the problem with with what transpired is that no one trusts the advice anymore. So people are bypassing treatments that might actually be helpful, and that's particularly important if you're in one of the vulnerable groups. If you're in the 65 and older group, if you have multiple medical problems, you should be taking advantage of all these discoveries, the vaccines and the therapeutics. But people are loath to do it because unfortunately, their trust has been undermined by what transpired during the pandemic. That's why, those statistics that you cited at the outset here, talking about how few people have taken the vaccine, even in those vulnerable groups, are so concerning. But the Fauci and the public health establishment wanted to run the show, and they ignored every other kind of consideration. They didn't care if they tanked the economy. They didn't care if people got thrown out of work. They didn't care if the lockdowns actually ended up increasing excess mortality from other types of medical problems. They didn't care if they shut down schools and destroyed kids' education and resulted in years of learning loss in math and reading. And those are effects that are suffered most by our most vulnerable populations. They didn't care about that. They've actually said so. Both Dr. Fauci and Dr. Francis Collins, the former NIH director, said we had a public health mindset. We didn't care about the other issues. Not only did they not care about it, but whenever anyone else tried to bring it up, whether it was at the COVID task force or later on with the Great Barrington Declaration, they actually took steps to suppress those point of views. They wanted to run the show. They insisted that these were the only things that mattered, their point of view. And we're suffering.
Well, I applaud what you're doing. I think people need to, it's out of sight, out of mind. But if we don't learn the lessons from the mistakes that we made here, what are we going to do next time but make them all over again? Anyway, Dr. Joel Zinberg, thank you, sir. Appreciate it. And I hope people will go to NRO and read your column. We'll also put it up on Hannity.com. Thanks so much for being here.